But first, the first case of Mpox has been detected outside Africa. Dr. Bharat Pankania, I should say, is a senior clinical lecturer in public health medicine at the University of Exeter's Medical School, and he joins us now. Dr. Pankania, I mean, this is not going to be the next pandemic, is it?
No, absolutely not. Let me absolutely reassure all our listeners and viewers, this is not a pandemic, and this hasn't got the signatures of a pandemic. We know how to deal with the Mpox virus. We have vaccines for it, and we know how it behaves. Having said all that, now is the time, having had the World Health Organization declare it a public health emergency, now is the time for rich, affluent nations with money and logistics experience, etc., to help Africa contain it. And we can contain it.
Well, you say that. We have seen a case outside Africa. Does that mean it's not going to be containable?
No, we can contain it. Although we have seen a case in Pakistan and in Sweden, we will have cases in other parts of the world. But this is not one of those explosive pandemic type viruses. And the WHO has done a good job in declaring it an emergency, meaning it opens up all those gateways for the vaccine manufacture, the vaccine administration, and all those logistics to start controlling it and containing it. But, Rachel, as I totally agree with you, we will see cases in other parts of the world, unfortunately.
Okay. There have been 18,700 cases and over 500 deaths reported so far this year, already higher than for the whole of 2023. The Africa Centres for Disease Control and Prevention has declared a continental public health emergency. That's in Africa. So, is it possible for those travelling to Africa to be vaccinated for Mpox as things stand? Are there supplies of the vaccine available to travellers? What is the advice for those travelling to Africa, for example?
So the mode of transmission is close bodily contact and or really close proximity to an infectious case where there may be droplet spread. So if I were a traveller to Africa, would I be asking for and getting the vaccine? I doubt it very much. And my reasons are as follows. Vaccines are in short supply. Ideally, you do not want to be going into an outbreak zone. And if you know the mode of transmission and you keep yourselves to yourself, then you are at very low risk. So say you want to go on safari to Kenya, Rwanda, Burundi, etc., and you are traveling in your own subgroup of people and you are not getting close to other people who may be potentially affected, who are in Africa, men who have sex with men, people who are having sex with people who are already resident there. That sort of thing are risk factors. But if you are just traveling, it's not a risk factor.
But we've seen cases of children with Mpox, which one presumes they did not get from sexual transmission. So
yes.
If it is possible droplet transmission, then it strikes me as somebody who's immunosuppressed, for example, may want an additional layer of protection rather than simple, social distancing, which is what you seem to be suggesting.
Sure. No, I agree with you. But let me address the children bit first. So close person-to-person contact is definitely the main route for those children who have been affected. And on the issue of I am immune suppressed and I need to go to Africa, what do you advise? I'd still doubt if we've got those vaccines in the UK where we can spare them to say, okay, here we go, you can have those vaccines. Because even healthcare workers who are dealing with these things, we are targeting only those people if they need it and we give it to them.
Okay, and just lastly, could you tell us where did this virus come from? Is it?
Sure.
I mean, there was some fake news or false information that it was spread from monkeys. Where did it originate?
So hence we used to call it monkeypox because the belief was that the natural reservoir are monkeys. However, we've learned more, and we learn as we go along. And then when you learn, you have to change things. So we feel the reservoir for these viruses are rodents. And as a result of working that one out, small mammals, small rodents, they've changed the name from monkey to Mpox because it was a lot easier to say that and do that. But Rachel, the bigger point is this. The more incursions humans make into the wild, the more of these things we will see. This is the big elephant in the room nobody addresses, which is the more you go into those forests and do things that you shouldn't be doing, you will get these infections, and then you will bring it to humans, and then you have human-to-human transmission.
Okay. How was human incursion into forests? Did they got into contact with rodents who carried the virus, is what you're saying,
yes.
and therefore the virus was born into the human population. Okay,
yes,
lucky we got you on to explain the real facts about Mpox. Thank you so much, Dr. Bharat Pankania, Senior Clinical Lecturer in Public Health Medicine at the University of Exeter.